When a child is injured in a traumatic incident like a shooting, helping them heal physically is only half the battle. That's where the Brain Center comes in. It provides mental health services for youth immediately following trauma. And our Brittany Moncrief has a look at how the Brain Center proves its value over and over again.
Time is of the essence, especially when it comes to our youth.
Just because of the precipitous rise that we've experienced here in Memphis in terms of juvenile and pediatric gun violence victims, coupled with the COVID pandemic.
Something has to change. And Bonheur Children's Hospital and the University of Memphis are starting with how to cope when children experience trauma. Through the Brain Center, founding director Dr. Irena Schaus and her team are making mental health part of bedside manner.
There was just such a critical need to provide integrated trauma mental health counseling services in the hospitals. It's not very common for hospitals to offer those services immediately upon entry to receive care.
But it's needed. Oftentimes, mental effects from trauma can be immediate, especially for kids.
Fight or flight response. You kind of see this hypervigilance where kids really startle very quickly because their body just can't cope with any kind of distress. They can be fearful to return home. Sometimes they have nightmares, they have flashbacks.
So the Brain Center counsels youth while they're physically recovering, totally free and unlimited. Since starting in 2021, just 1 year ago, the Brain Center has provided more than 2,500 sessions to more than 1,800 children and their families.
We talk about what's called acute stress disorder. Acute stress disorder is kind of like the pre-diagnosis to PTSD. We teach children and their families like what to look out for,
in hopes of preventing any harmful or bad coping strategies.
The earlier you can get help, the better. And I think that works always with mental health. But the sooner you identify the symptoms, the sooner you can work on fixing the problem.
And solutions may take time, but our responses should not. In Memphis, I'm Brittany Moncrief.